A life changed in an instant. Dr. Emily Roberts was a well-respected surgeon at one of the top hospitals in a bustling city. Known for her skills and her unwavering dedication to her work, she had built a solid reputation over the years. However, there was something that most people didn't know about her, a deep-seated prejudice she had inherited from her upbringing. Despite her accomplishments, she held a subconscious bias, especially when it came to Black patients. One particularly busy afternoon, Dr. Roberts was preparing to meet her next patient, a man who had been admitted with a critical condition, severe chest pains. When her assistant, Sarah, handed her the file, she paused for a moment. His name was Malik Johnson, a 34-year-old Black man. Dr. Roberts furrowed her brow. She had a few run-ins with patients like him in the past, and she couldn't shake the feeling that they were less deserving of care. She attributed this feeling to the stereotypes ingrained in her, though she would never admit it to anyone. As Malik was wheeled into the room, Dr. Roberts took a brief glance at his file and immediately dismissed his case. "We need to send him to another doctor," she instructed. "I'm too busy to deal with someone like him." Sarah, surprised by the remark, hesitated. "But Dr. Roberts, his condition is serious." "I know what I'm doing." "Sarah," Dr. Roberts cut her off. "Just make sure he gets sent to someone else." But Malik, despite his condition, overheard the conversation. He sat up, his chest heaving with pain. "What do you mean by someone like him?" Dr. Roberts' face flushed with embarrassment, but she quickly composed herself. I just mean that your case doesn't fit my current schedule." Malik didn't respond at first, but he could see the truth in her eyes. The dismissal was clear. He was about to speak when Sarah intervened. "Please, Dr. Roberts, you should see him. It might be something serious." For a moment, Dr. Roberts debated, but the frustration of the long day and the prejudice she couldn't quite suppress led her to agree. "Fine," she said coldly, "but just this once. You better make sure he leaves quickly." Sarah led Malik to the examination table, where he reluctantly lay down, grimacing in pain. Dr. Roberts approached, looking over the file again. Despite her resistance, she started asking the usual questions, trying her best to mask the annoyance she felt. But the deeper she dug into Malik's medical history, the more she realized something unexpected. Malik was not just any patient. He had been serving as an emergency responder for over 10 years, saving countless lives in dangerous situations. But what struck Dr. Roberts was the name of the organization he worked for. It wasn't just any rescue team. Malik was part of a specialized unit that helped to evacuate people from natural disasters worldwide, including the recent floods that had devastated parts of the country. The weight of his selflessness hit her hard. Here was a man who had risked his life countless times to help strangers, regardless of their race, background, or color. The realization was sharp, like a slap across the face. How could she, with all her years of education and experience, have dismissed him based on the color of his skin as the tears welled up in her eyes? She turned to Malik, her voice faltering. I am so sorry. I didn't realize." She had no words that could fix what she had done, but she needed him to know she was ashamed. Malik, still in pain, but now more composed, met her gaze. "I've heard it all my life. I'm used to it. But it doesn't make it right." His words were calm, but the pain they carried was undeniable. Dr. Roberts paused for a moment before speaking again. "You've saved more lives than I can count. I don't deserve the privilege of treating you, but I will make sure you get the best care possible." And from that moment on, Dr. Roberts went above and beyond to provide Malik with the best treatment she could offer. As she worked with him, she learned more about his life, his sacrifices, and his unshakable resolve. His story changed her, not just as a doctor, but as a human being. The biases she had once held were dismantled piece by piece, and for the first time, she understood that true compassion had no color. The day Malik left the hospital, he shook Dr. Roberts' hand. "Thank you for being better than your first impression," he said with a small smile. It was a moment that stayed with her forever. Dr. Roberts never forgot the lesson she had learned from Malik, and for the rest of her career, she treated every patient with the respect and care they deserved, never once allowing prejudice to cloud her judgment again.